Our topic today, the brain tumor. Welcome to International Academy Germanische Heilkunde by Dr. Hamer, MD. My name is John Holledauer. At GHK Academy, I am responsible for representing the original seminar program, according to Dr. Hamer, in the English language. The term tumor actually means swelling, lump, or growth. For example, if you hit your thumb with the hammer, the body immediately starts to heal this injury, and it does so with the help of edema storage. So the thumb becomes thick. However, this swelling of the thumb is usually not called a tumor. However, the swelling in colon cancer or breast cancer is completely different. Real cell division is present here, whereby the colon cancer or breast cancer become larger and larger. Now there are three different groups of special programs. One group is the glandular tissue. It makes cell divisions in the active phase, just like colon and breast cancer. The second group is connective tissue and squamous epithelium. It makes cell divisions in the healing phase, like lymph nodes or milk ducts. The third group makes neither, but a loss of function, such as diabetes. Nerve cells, on the other hand, cannot divide at all after birth. Nerves do neither cell proliferation nor cell loss. They only can cause functional failures, such as paralysis or the painful rheumatism of the periosteum. But what about the so-called brain tumor? In the brain, we have tens of billions of nerve cells, and just as many as glial cells, with the total weight of approximately 53 ounces. Glia is a special connective tissue directly at the nerves. Now, in a DHS, the hammer focus arises instantaneously at the brain relay associated with the conflict content. If one has a morsel conflict, this hammer focus is in the brainstem. If one has a care conflict about the child, then the hammer focus is in the cerebellum. If one has a self-esteem conflict, it is in the cerebrum medulla. If one has a separation or territorial conflict, it is in the cerebral cortex. In the conflict active phase, this hammer focus is disc-shaped and sharp-edged. What exactly causes these ring structures, nobody really knows, but you can photograph it with the computer tomography. Surgical nurses report one can also see this hammer focus in the open brain with the naked eye. Now, when this conflict is resolved, this brain relay deposits edema. We know this process from our example with the thumb. This edema deposit is now called a brain tumor in conventional medicine, knowing full well that this cannot be a case of nerve cell divisions, since it is well known that nerves can never divide after birth. This edema deposit is space demanding and causes corresponding symptoms such as headaches, dizziness, etc. In rare cases, it can lead to dangerous intracranial hypertension, which may then have to be relieved with cortisone, or even the skull bone have to be lifted off to relieve the pressure. What you must not do, however, is to cut into the brain. That would be like ripping out a chip of the computer. So, removing a supposed brain tumor is medical malpractice. More and more of this edema is stored until the crisis, about in the middle of the healing phase. The task of this crisis is to stop this edema storage and to squeeze it out. The crisis also marks the beginning of the so-called urinary flood phase, in which the previously stored water is peed out again. The cause for the diagnosis of a brain tumor with subsequent brain surgery is the epileptic seizure, which is the crisis following the resolved motor conflict. Shortly after the seizure, one often sees quite impressive edema deposit in the motor cortex center and cuts out this brain relays without further thinking. Transferred to cars, this procedure would be like to remove the flashing all-control lamp. In the second part of the healing phase after this crisis, glia is now stored in this brain relay at the scar tissue. This scarring remains in the end of the healing phase, just as any scarring on the organ remains. However, the brain is completely functional again, and we are completely healthy again. In the future, it is important to protect the patient from recurrences. If you now have a brain CD in front of you of a completely unknown patient with a supposed brain tumor, you can, if you can read brain CDs, say immediately that this person has solved his conflict, otherwise he would not have his edema deposit. And depending on where exactly this edema is located, one can say which conflict he must have solved. But one not only knows his psyche, we also know with which SPS he is in healing on the origin level. So we can also name his healing phase symptoms. To the point, every so-called brain tumor is a healing phase symptom. In the rarest cases, emergency medical intervention is necessary. Attention. Simply doing nothing does not mean practicing germanische Heilkunde. Sometimes it is necessary to intervene with medicine or by lifting the skull bone. Here we would need emergency medicine. Help to spread germanische Heilkunde, because it must become kind of popular medicine. This knowledge belongs to the general education anyway. Goodbye. See you in the following video.
Germanische Heilkunde is considered by those who have understood its underlying principles to be the most significant discovery in known human history. While conventional medicine is based on more than 5,000 hypotheses, Germanische Heilkunde can be proven at any time to be the only medicine that is scientifically verifiable. With Germanische Heilkunde, for the first time in recorded human history, there is a scientifically verifiable medicine for each patient case. More than 30 medical universities have already confirmed this in the past. Still, Dr. Hamer's discoveries have been suppressed and denigrated for over 40 years. Take your health into your own hands and learn Germanische Heilkunde while you are still healthy. For this purpose, the GHK International Academy offers you an extensive program of seminar tutorials from the basics through the organ level to the psychoses. This seminar program will change your relationship with your body and your health once and for all. You will find the direct link to the homepage of the GHK International Academy below the video.